The emergency room doors burst open at St. Mary's Hospital. Two paramedics rushed in, wheeling a pregnant woman on a stretcher. Her face was pale and twisted in pain. Her husband ran beside her, gripping her hand, his eyes wide with fear. "She's 38 weeks pregnant," one paramedic shouted. "Heavy bleeding started 20 minutes ago. Blood pressure dropping fast." Nurses swarmed around the stretcher. The overhead lights flickered as they rolled her toward the delivery wing. Somewhere in the chaos, a monitor started beeping. Fast. Too fast. Dr. Sarah Chen stood near the nurses' station. She was only 28 years old, fresh out of her residency program. Her white coat still looked new. Her name tag gleamed under the fluorescent lights. She had been at St. Mary's for only 3 weeks. She looked up from her chart when she heard the commotion. Her eyes followed the stretcher. Something felt wrong. Very wrong. The head of obstetrics, Dr. Raymond Clark, appeared from around the corner. He was 62, tall, and confident. He had delivered thousands of babies in his career. Everyone respected him. Everyone listened to him. "Get her to delivery room 2, Dr. Clark ordered. Prep for emergency cesarean. This looks like placental abruption." Sarah stepped forward. Her voice was calm but firm. "Dr. Clark, may I take a look at her chart?" He barely glanced at her. "We don't have time for second opinions, Dr. Chen. This is a clear case. We need to operate now." But Sarah had already moved closer to the patient. She watched the woman's breathing. She noticed the way her belly was shaped. She saw something the others had missed. The patient screamed. Her husband's face went white. Nurses scrambled to check the monitors. "Fetal heart rate is dropping," a nurse called out. 110. 100. 95. Dr. Clark's jaw tightened. "Move faster. Get her into the OR now." Sarah spoke again, louder this time. "Dr. Clark, I think we should check for Dr. Chen," he snapped, turning to face her. "You've been here 3 weeks. I've been doing this for 40 years. Step aside and let the experienced team handle this." Other staff members glanced at Sarah. Some looked sympathetic. Others looked annoyed. One senior nurse shook her head slightly, as if warning Sarah to stay quiet. But Sarah didn't move. She had seen this before. Not once. Not twice. 20 times. Before coming to St. Mary's, Sarah had spent 2 years in a rural clinic in Kenya. There were no fancy machines. No ultrasounds on every floor. No teams of specialists waiting in the hall. Just her, a midwife, and mothers who trusted her with their lives. She had delivered 20 babies in the most difficult conditions imaginable. Breech births. Twin deliveries. Mothers bleeding out on tables held together with duct tape. She had learned to see what others missed. She had learned to trust her instincts. The stretcher disappeared into the operating room. Dr. Clark followed, barking orders. The husband was stopped at the door. He stood there, helpless, watching through the small window. His lips moved in silent prayer. Sarah stood in the hallway. Her heart pounded. She knew what was happening inside that room. She knew they were wrong. A young nurse approached her. "Dr. Chen, maybe you should just let it go. Dr. Clark knows what he's doing." Sarah looked at the husband. Tears streamed down his face. His hands pressed against the window. Inside, monitors beeped frantically. Voices shouted. Something metal clattered to the floor. Then Sarah heard it. The sound that made every doctor's blood run cold. The long, steady beep of a flat line. Not the mother's heartbeat. The baby's. The husband collapsed against the wall, sobbing. Nurses froze. Through the window, Sarah could see Dr. Clark's face change. Confidence turned to confusion. Confusion turned to fear. They were losing them both. Sarah took a deep breath. She pushed open the operating room door. Every eye turned toward her. Dr. Clark looked up from the table, his hands covered in blood. "Get out," he said. "We're in the middle of." "You're doing the wrong procedure," Sarah said. Her voice didn't shake. "That's not placental abruption." The operating room went silent. Dr. Clark stared at Sarah like she had lost her mind. The surgical team stood frozen. The patient lay on the table, unconscious, her life slipping away with every second. "Excuse me." Dr. Clark's voice was ice cold. Sarah stepped closer to the table. Her eyes scanned the patient quickly. "It's not abruption. It's vasa previa with a ruptured vessel. If you do a standard cesarean from that angle, you'll cut directly through the baby's blood supply. The baby's already losing blood. That's why the heart rate dropped." Dr. Clark's face turned red. "That's an extremely rare condition. The symptoms clearly indicate." "The bleeding started suddenly, not gradually," Sarah interrupted. "The blood is bright red, not dark. And look at her belly. The baby's position is wrong for typical abruption." A senior surgical nurse glanced at the patient, then at Sarah. Something flickered in her eyes. Recognition, maybe. Or doubt. "We don't have time for guessing games," Dr. Clark snapped. "Every second we waste." "Then let me confirm it," Sarah said. She moved to the ultrasound machine in the corner. 30 seconds. "That's all I need." Dr. Clark opened his mouth to refuse. But then the mother's monitor started beeping erratically. Her blood pressure dropped again. The anesthesiologist looked up, alarmed. "She's crashing," he said. Dr. Clark hesitated. Just for a moment. But that moment was enough. Sarah pulled the ultrasound machine to the table. Her hands moved quickly, confidently. She placed the probe on the patient's belly and stared at the screen. Her eyes narrowed. "There," she said, pointing. "See that? The blood vessels are running over the cervix, right in the rupture zone. It's vasa previa. I'm certain." The senior nurse leaned in. Her eyes widened. "Oh my God. She's right." Dr. Clark looked at the screen. His face went pale. For the first time in 40 years, he had missed it. And it could cost 2 lives. "If we cut where you planned," Sarah continued, her voice steady, "we'll sever what's left of the baby's blood supply. We need to go higher, avoid the vessels completely, and we need to do it right now." The room hung in terrible silence. The monitors beeped. The mother's breathing was shallow. Somewhere outside, the father was praying. Dr. Clark looked at Sarah. Really looked at her. Then he stepped back from the table. "Show me," he said quietly. Sarah didn't waste a second. She scrubbed in while giving instructions. "We need to make the incision here, above the vessel network. Nurse, I need suction ready immediately. The baby will need resuscitation the moment we get him out." Her hands were steady. Her voice was calm. This was not her first time racing against death. She made the incision exactly where she indicated. Clean. Precise. Fast. "Suction," she called. The nurse responded instantly. Sarah's hands moved inside the patient's belly. She navigated around the tangled vessels carefully, avoiding the deadly trap that would have killed the baby. "I have the head," she said. "Delivering now." She lifted the baby out. A boy. Small. Blue. Silent. The pediatric team took him immediately. They worked on him while Sarah delivered the placenta and began closing the mother. Dr. Clark assisted her now, his hands following her lead. Seconds felt like hours. The room held its breath. Then, a sound. Weak at first. Then stronger. A baby's cry. The pediatric nurse smiled. His breathing. Heart rate coming up. 80. 90. 100. The mother's monitors stabilized. Her blood pressure began to rise. Color returned to her face. Sarah closed the final suture. She stepped back. Her hands were shaking now, but only slightly. Dr. Clark pulled off his gloves. He looked at Sarah with something new in his eyes. Respect. Gratitude. Humility. Where did you learn to catch that? He asked quietly. Kenya, Sarah said. Rural clinic. 2 years. 20 deliveries just like this one. No ultrasounds. No backup teams. Just experience. Dr. Clark nodded slowly. He turned to the surgical team. Dr. Chen just saved 2 lives that I nearly lost. I think we all owe her our attention from now on. The nurses nodded. Some smiled. The anesthesiologist gave Sarah a respectful nod. Outside, they brought the baby to his father. The man wept, holding his son against his chest. When they told him what happened, he asked to meet the doctor who saved them. When Sarah walked out, still in her surgical gown, the father grabbed her hand. Thank you, he whispered. Thank you for not giving up. Sarah smiled. That's what we're here for. Dr. Clark watched from the doorway. The inexperienced young doctor had just taught him the most important lesson of his career. Sometimes, experience isn't about years. It's about lives saved.